the best facial cosmetic surgery procedure in 2026. Hi, I'm Dr. Suresh, Senior Consultant Maxillofacial Surgeon, Gnathos Facial Surgery. One wrong procedure can compromise entire facial aesthetics and function. So be cautious when you're really trying to improve your facial aesthetics and cosmetic jaw surgeries. Instead of focusing on one area like nose or jawline or chin, a maxillofacial surgeon will be able to look at the face holistically, right from your forehead to the chin, and see the width of the face, height of the face, the profile of the face, the function of the jaws, the projection of the nose, thereby planning the treatment. These are called as advanced facial sculpturing or orthognathic surgery or facial profile balancing. With advent of 3D technologies and artificial intelligence tools, we are able to really diagnose where is the defect. Instead of focusing on one narrow area, look at the face as a broad whole, as a structure, and try to identify the exact defect and then address the defect, thereby enhancing the aesthetics and function and overall balance of the face. So, a maxillofacial surgeon initially takes a detailed clinical history to understand what the patient is really looking for. This plays a very important role unless we understand what the patient really wants it. After that, on detailed clinical examination with the front view and side view, we can assess the forehead proportion, the mid face proportion and the lower face proportion. Based on that, we are going to subject the patient to a series of x-rays. After analyzing the facial profile, quantitatively we will be able to identify where exactly is the defect. The same information is carried to the 3D facial mapping and 3D facial sculpturing models are created. With this 3D designing, the exact identification of the defect makes it much easier for the patient as well as the surgeon to understand the problem exactly. Then the surgical planning comes on basically 3D models only. We are able to mimic the 3D mock surgeries. So the same position guides are transferred to the patient in the surgery. This creates a very high precision results which are very permanent, which enhances the beauty of the face, which enhances the function of the face. Procedures which were used in the previous like fillers and Botox have taken back seat because the results with the procedures like Botox and fillers are which are temporary. Whereas a maxillofacial surgeon can correct the structure of the face, the results are very permanent and the recovery is fast. So instead of undergoing a repetitive procedure, a single procedure can maintain the facial balance for a lifetime. These procedures are highly sophisticated with advanced technology and which are very safe to undergo. The patient really appreciate the overall confidence and the beauty of the face. If you find this information valuable, please share it with the people who are in need of it, and do comment if you find any facial profile balance issues in this video.